Hello and welcome to the Green Square Urgent Care Service. My name is Dr. Daniel Chandrasekhar and I'm the Clinical Director, and I just wanted to give you a bit of a guide as to what to expect, what kind of things we see in urgent care, what kind of things we don't see, and what the eligibility criteria are. So you know when to come to see urgent care, when to see your regular GP, and importantly, when to go to the emergency department. The Green Square Urgent Care Service is funded by the New South Wales Health Department and help sponsored by the Central and Eastern Sydney Primary Health Network. Green Square Health is co-hosting this urgent care service, which is a separate business, designed to see anyone who meets our eligibility criteria. The eligibility criteria for the New South Wales Health funded urgent care service is to have a valid Medicare card or be a community-based asylum seeker, be a resident of New South Wales or live in its border areas, have an urgent need that needs to be seen within 2 to 12 hours, that is not an emergency. So something very significant. If you think you're having a heart attack, you're having an active seizure, you're having a stroke, that's a 000, go to the hospital kind of scenario. And it's something that you can't get in to see either your GP or a local GP in your community in the next 24 hours. Typical things that might need to be seen in the urgent care service include acute injuries such as ankle sprains where you think something might be fractured, wrist injuries where you think something might be fractured, small burns where you might need a dressing and assessment of it, lacerations that need repair, the sutures or glue to close them because they won't stop bleeding. Anything that can be seen in 12 hours, we suggest you see your regular GP, as there would need to be follow-up of that issue, and that's something that urgent care can't provide, is ongoing follow-up. But something that can be seen on the day, treated on the day, and pretty much as a closed loop, that's the kind of thing that urgent care aims to do when your GP isn't available for booking. Things that we don't do by default is if you just need a medical certificate, that is not something the urgent care service can provide. If you need a workcover certificate for a work injury, we can't provide that either. We can assess the injury for you, but you'll need to see your regular GP to get a certificate and have that continuing care. If you need follow-up of a chronic disease issue or repeat medications, that is not something we can provide, and we strongly encourage you to make appointments ahead of time with your general practitioner for these things. So how do you come to see the urgent care service? You can either call healthdirect on 1-800-022-222 and tell them about your issues, and they will usually try to guide you to the most appropriate service. And they may tell you to make an appointment with your GP to see the urgent care service if they think that's most appropriate, or to go to the emergency department. Depending on where you live, there may be other virtual services available that they can link you in with as well. The alternative to this is to walk into the urgent care service. Walk-in systems aren't always the best, but sometimes it's the easiest way to know if what you need to be seen is urgent enough and if we have the capacity to see you. So what happens when you present to the urgent care service? At Green Square Health, our urgent care service is separate to the regular Green Square Health service. So you'd walk past the main reception and there are signs to point to the urgent care reception area, where the receptionist will check your eligibility criteria first, take a very brief statement of why you're here, and then take your details down and let the nurse know that you've arrived. The nurse will then bring you into their nurse triage area, do a quick assessment, ask you some questions to see if there's something we can help you with quickly, or if there's something that needs to be escalated to the doctor sooner, or is eligible or not. Now, if you clearly do not meet the eligibility criteria, or it's a situation that's not urgent enough in the medical sense, we may turn you away after offering you a solution of what to do next, and return you back to the care of your general practitioner. If the care needs to be seen by the GP on the urgent care service on the day, you'll be placed into a queue where we see people on the degree of their urgency. Sometimes it's not apparent that something is more urgent than another issue, so please bear with us if someone who's come after you has to be seen before you. There can be some wait times, particularly on the weekends and on the evenings. We'll endeavor to let people know what the estimated wait time is. Once you're seen and assessed by the urgent care doctor on duty, they will always provide you with a written summary of what the assessment was, what the plan is, and they'll either give that to you by your preferred method, by printing it, by emailing it to you if you prefer. They will also always send a copy to your regular general practitioner, and where possible, we'll upload this to the My Health record, so it can be found if you need to go to the emergency department, or if you end up seeing a different GP, they might be able to download it and see what the outcome was. Any investigations that need to be ordered as part of your urgent care episode, will be reviewed by one of the urgent care doctors and they'll contact you if it's necessary. Copies of it will also be sent to your regular general practitioner. So if everything is normal, they'll be able to see that that result came back in a normal way. If we lend you any equipment such as crutches, we can only lend it for you for a limited amount of time. So please endeavor to return it within about 72 hours. Pharmacies and physiotherapists do keep crutches for purchase or hire. The goal of the Green Square Urgent Care Service and all the New South Wales Health Urgent Care Services is to bridge that gap when your GP isn't available and the emergency department just seems like not the right place to go to today. We aim to keep people in the community, have them treated so they can be followed up by their regular general practitioner where appropriate. And also, if someone does need to go to the emergency after they've seen it in urgent care, we make sure that the appropriate handover is given so the care can be really timely and expedient. If you do end up requiring urgent care, which we hope you don't have to, this video hopefully goes a bit of a way to explain in which situations you should be able to come in and which situations you should see your GP for. If there's any questions at all, please visit healthdirect.com.au or give them a call on 1-800-022-222.